Early warning signs of colon cancer you should not ignore. Excluding skin cancers, colon cancer is the third most common cancer diagnosed in the world. Colon cancer or colorectal cancer symptoms may be minor or non-existent during the early stages of the disease. The symptoms may not develop until the disease has progressed into stage 2 or beyond. But when this cancer is detected in an early stage, the recovery rate can be as high as 90%. This is why regular screening tests for cancer of the colon or rectum, especially with a colonoscopy, are recommended as part of a health plan for those over 50 years old. Regular screenings are also highly recommended for those under 50 who are at high risk or have a family history of the disease or other cancers. You can also detect colon cancer by looking out for symptoms and signs of the disease, which we are going to discuss in this video. But first, let's try to understand what colon cancer is. Colon cancer is basically cancer of the large intestines and/or rectum. The colon and rectum make up the large intestine, which is part of the digestive system. Most of the large intestine is made up of the colon, which is a muscular tube about 5 feet. The parts of the colon are named by which way the food travels through them. The first section is called the ascending colon. The second section is called the transverse colon. Then comes the descending colon, and finally, the fourth section is the sigmoid colon. The sigmoid colon joins the rectum, which then connects to the anus. Most colon cancers start as a growth on the inner lining of the colon or rectum. These growths are called polyps. Most of the polyps are not cancerous, but some may grow out of control and change into cancer over time, usually many years. So what are the risk factors of colon cancer? Your risk of colon cancer goes up as you age. Both men and women are equally at risk for colon cancer. Colon cancer is most common among people aged 50 and older, but can occur in patients as young as teenagers. If you have a history of colorectal polyps, you are at increased risk of developing colorectal cancer. This is especially true if the polyps are large or if there are too many of them. If you have inflammatory bowel disease or IBD, including either ulcerative colitis or Crohn's disease, your risk of colorectal cancer is increased. IBD is a condition in which the colon is inflamed over a long period of time. You're also at risk if you have a family history of colon cancer. Most colon cancers are found in people without a family history of colon cancer. Still, as many as 1 in 3 people who develop colorectal cancer have other family members who have had it. If you are overweight or obese, your risk of developing and dying from colon cancer is higher. If you're not physically active, you have a greater chance of developing colon cancer. A diet that's high in red meats such as beef, pork, lamb, or liver, and processed meats like hot dogs raises your colon cancer risk. People who have smoked tobacco for a long time are also more likely than people who don't smoke to develop and die from colorectal cancer. Smoking is a well-known cause of lung cancer, but it's linked to a lot of other cancers too. Moderate to heavy alcohol use also has been linked to an increased risk of colon cancer. Even light to moderate alcohol intake has been associated with some risks. And now, what are the early signs of colon cancer? Colorectal cancer may not cause symptoms, particularly at first. Someone can have colon cancer or rectal cancer and not know it. That's why every person should get screened starting at age 45. It is important to remember that most of these symptoms may have causes other than colon cancer. Fear of a cancer diagnosis shouldn't keep you away from seeing your healthcare provider if you are experiencing symptoms. Chances are good that your symptoms can be treated. If cancer is suspected, the earlier the cancer is detected, the better off you will be. Symptom number 1: blood in your stool. One of the most disturbing symptoms of colon cancer can be bleeding from the rectum or blood in the toilet. This blood is usually bright red, and it can be found in the toilet bowl water or on toilet paper. Conditions such as hemorrhoids or fissures can also cause small amounts of blood. So if you notice blood, contact your physician and be sure to explain any other symptoms that you may be experiencing at the same time. Change in the appearance of the stool. The way that your stool looks can be a good indicator of what is going on inside your body. Small, hard stool is an indicator of constipation. But if you notice a sudden change in the shape of your stool, for example, if your stool becomes thin, narrow, or ribbon-like, this could be an indication of changes inside your colon. Contact your healthcare provider to have the condition evaluated. You may also notice a change in the color of your stool. For example, blood in the stool or darkened or tarry stool could also be an indication of problems inside the colon. Change in bowel habits. One of the first signs of colon cancer may be a change in bowel habits. For example, you may begin having constipation or diarrhea. Loose stool and diarrhea are common occurrences. The condition can be caused by intolerance to certain foods, medication, stress, or exposure to bacteria. In most cases, diarrhea will resolve itself within 2 to 3 days. But you must consult your healthcare provider if diarrhea lasts more than 3 days. Constipation is defined as having less than 3 bowel movements in a week, and it is one of the most common gastrointestinal complaints. Having constipation, however, does not mean you have colon cancer. Physicians generally recommend that if you have constipation for more than 2 weeks, you should see your doctor so a cause can be determined. Symptom number 4, abdominal pain. Some people with colon cancer may not have pain until the disease is in its later stages, depending on the location of the tumor and other factors. However, for others, abdominal pain can be an early sign of colon cancer. Like many of the other symptoms of colon cancer, abdominal pain can have a lot of other causes. If you are experiencing abdominal pain that isn't explained by some other condition, it is time to talk to your doctor. Trouble passing stool or tenesmus. Changes in the passing of stools is a symptom of colon cancer. Tenesmus is the feeling of having to defecate without having stools. It is basically a feeling of being unable to empty the large bowel of stool, even if there is nothing left to expel. If you're liking our video so far, then don't forget to hit the like button and subscribe to our channel so you never miss out on our 2 new videos every week. So thank you for that, and now let's get back to the video. Symptom number 6, anemia. Colon cancer often causes bleeding, sometimes without you knowing it. When there is consistent blood loss, you may develop anemia. You may discover that you are anemic on a routine blood test, or you may suspect the condition when you notice the symptoms of anemia, such as extreme fatigue and weakness, shortness of breath, irregular heartbeat, cold hands and feet, and pale skin. Anemia has many possible causes, including a simple lack of iron in your diet. However, because you could have internal bleeding and not realize it, the cause of anemia should always be investigated to rule out serious illnesses like colon cancer. Unexplained weight loss. Unexplained weight loss is another possible symptom of colon cancer. In fact, unexplained weight loss can be a symptom of several different types of cancer. If you lose more than 10 pounds over a period of a few months without trying, it may be a sign of a problem. If you notice any of these changes, or if you experience any other signs of colon cancer, please make an appointment with your doctor as soon as possible. Depending on the situation, your doctor may recommend blood work, a colonoscopy, or other forms of testing to rule out colon cancer. Thanks for watching. If you liked this video, then give it a thumbs up. And now go ahead and watch any of the 2 videos on your screen to learn more about your health and wellness.